Hi, welcome to this episode of The Keys to Therapy. In today's episode, we're going to cover treatment plans, what they are, how to write them, and why they're important. So typically after the first session, which we covered in last episode, the assessment, biopsychosocial intake, whatever it is that you and your agency call it, after that first session, you're expected to write some sort of treatment plan. You've met with the person, you've likely come up with a diagnosis, you have an idea of what their goals are, then you have to figure out what to do with all of that. So typically it's good practice to write up a treatment plan. So all that a treatment plan is a document that lists what the presenting problem is for the client, what the goals are, and how you're going to work on them. So one reason why treatment plans are important is because insurance typically requires them. So if you're at a place that takes insurance and they ever audit or they want to look at the chart, they're going to want to see that you're actually working towards something. And I know usually the notes will show something along those lines of like the progress you're making or stuff that you're working on, but it helps to have a document that is sort of like the framework for what the purpose is for the sessions. And that's what the treatment plan is. So definitely something insurance requires. It's also good if you don't take insurance to have some sort of treatment plan because again, it's just good practice. It's good to have some sort of document there that shows like what it is that you're working towards with the client. It also is helpful because most insurances have you review it every 90 days. And even though I don't take insurance, I still review my document every 90 days because goals change. So for the first session, I might have one of the goals be establish rapport with therapist. Well, hopefully 3 months in when I review it, that goal's been met. So I can cross that off and maybe another goal's been met or now another goal's added because as you gather more information about the client, there may be other stuff that comes up. So maybe a few months in, they've disclosed that they have some sort of trauma history that they didn't talk about at the intake. Well, now you can add a goal towards that symptom or those issues, and your treatment plan becomes something that is workable. It doesn't have to stay the same. It's going to change as you work with the client and the client changes, or like I said, the goals changed or adapt. So it helps you as a clinician stay on track. Sometimes you meet the client for the first session, you got all the goals laid out, you're good to go. But then as you're meeting with them, things kind of get off track. Like maybe the client is going through a situation right now that pops up like the second or third session, and that becomes the main focus. So then after talking about that for a while, you go to review the treatment plan at 90 days and you're like, oh, they actually came in for this. Like it's been a minute since they've talked about that. I kind of forgot. So let me make sure we circle back to that issue. So it's, again, good practice. It's nice to have that document as a reference. And it kind of protects you as a clinician to show like, hey, this is what we're actually working on. This isn't just us meeting and talking. Like we have an entire plan here for how we're going to tackle the issues that they came in with that they want to work on. Now, as far as what they look like, treatment plans are going to be a little bit different depending on where you work. Most places will have some sort of template, or most software programs that you use will have a template. So I know for my practice, I use Simple Practice, which is an electronic health record. And there's a few different templates in there for treatment plans. So there's one that's super basic. There's one that's very detailed. And there's one that you can pay for. It's like an add-on that's very, very detailed. So it's kind of up to you and the place that you're working at to decide. But for the most part, there tends to be like 3 or 4 sections to the treatment plan. So the first part is the presenting symptoms or problem. So the very first line, you would kind of put out there like the client reported feeling anxious over the last 6 months. They shared that they are experiencing nightmares. They are having headaches, appetite changes, etc. Like you would just list what it is from the client's words, verbally, and what they've written down, and put that down as the presenting problem, because then that shows like the justification right off the bat for why there needs to be treatment. So you would fill out the presenting problem, then you would have the objective. So you may have multiple objectives depending on what they're there for. So the first objective might be that the client wants to reduce anxiety. So if you can, and this is going to be more particular depending on where you work, who's supervising you, and again, if you take insurance or not, you want to have some sort of measurable goal listed under the objective section. So for example, the goal, instead of just saying client will reduce anxiety, you may put client will report a 50% reduction in anxiety symptoms. So that way there's something kind of measurable there. You can say like, okay, well, they scored, a 15 on the GAD, the questionnaire they did the first session, but 3 months in, 6 months in, a year in, I gave it to them again and they got, a 6. So that would be more than 50% reduction. So you want to be able to have something measurable there. It's helpful. And like I said, some places are going to be a lot more strict on that. They're going to want extremely measurable goals. They're going to want percentages. They're going to want numbers, things like that. So, and again, it's kind of good to have something to go back to and something to measure. Just because it helps you realize you've stayed on track, and it helps the client when you're like, hey, remember the first session, you said that you were feeling all of these symptoms and you rated your anxiety at like a 10. Well, recently the highest you've rated it is like a 6. So it sounds like things are getting better. It kind of helps with that like rational language when you're talking so much about things that are emotional. So again, you're going to have the presenting problem first, then you're going to have the objective. So describing what it is that you're working towards. And you can have multiple objectives. It may be one for the anxiety, one for social relationships, one for depressive symptoms, one for increasing coping skills. You may have a bunch of different ones. So kind of keep those in mind. Some people include a subjective section. So you could put in what the client's words are. So if the client says, I just want to feel better. I want to be able to sleep through the night. I want to be able to make some new friends and not feel so lonely. I want to be able to put myself out there and feel more confident and not physically ill every time I have to be social. So there might be some different things like that, but you want to put down whatever the client's goal is too. And I typically put it in quotes. So it's, you pull that from the assessment when you've asked them, like, what are their goals for therapy? And then the last section is the intervention section. So that's where you'll put down how you're going to meet those goals. So that's usually where you would write down some of the modalities. So are you using cognitive behavioral therapy to help them reduce their anxiety? You may be using EMDR. So maybe you are using person-centered therapy or art therapy. Maybe you're using IFS. There's so many different modalities, and I'm sure we'll cover those, and I'll have people on here who would train in different ones that can go into them in way more detail. But you will write down under the intervention section what it is that you are using. So what kind of practice or what sort of, like role playing or something, what kind of skill are you teaching them or building with them so that they can actually meet that goal. So that's sort of how you write the treatment plan. Again, it may be different depending on where you work. I've seen some places that have very detailed ones that it looks like almost like a tree. It'll be like, here's this, but then here's this and this and this and this and this and then this one and all these different sections. Like they can be very, very detailed. But you can kind of have at least this initial framework to go off of so you know what's expected. You can also write some of this up with the client. So at the end of that first session, like I mentioned, when you're asking them, like, what are the goals that they have for treatment, write some of those down so that you've got those quotes to put in later. Talk to them about how you guys are going to work on that together. And you could put together like the basic parts of the treatment plan with them in the room, or at least get some of the info that you would need. So if when you write it up later, you've got it right there. So definitely make sure somewhere in that assessment you're talking about some of these issues. Now, as far as tips go for treatment plans, what I've done at pretty much every place I've worked, and I really highly recommend you do this too, is have some sort of like Word document on your computer and list out the typical goals that clients would have. So everyone's going to have like a general objective, right? Like if you're an anxiety therapist, most people are going to be coming to you to reduce their anxiety. So maybe in your template, when you've got a list of like multiple objectives that a client may have, you write all of them down. So you'll have that 50% reduction in anxiety symptoms. Maybe one of the objectives that is listed is increase social contact by 30% over the next 3 months. Or maybe it's something along the lines of report sleeping through the night most days than not over the next few months. You know, whatever that population is that you work with, make sure that that's kind of mirroring what those objectives are, but put them in a template. You have so much paperwork to do as a therapist. And if the treatment plan has to be done the first session, which typically it does, the first session's the one with the most paperwork for the client and for you, because writing up an assessment takes a long time. And then you got to do like a mental status exam, which is just kind of the client's state of mind, you know, how they looked, how they dressed, their affect, things like that. Their overall, like, your overall impression of their mood. But you also then have to write up a treatment plan. So it takes a long time. And most people are going to be coming in with the same kind of general objectives. And you're going to have the same general modalities you use for everybody. So obviously you can kind of alter the goal depending on the person. But if you already have a list of templates, like you have your own cheat sheet of stuff, it's going to make this writing process a lot easier. And the main part you'll have to change is this objective. What is it that the client wants? And that's easy because you already asked it. So highly recommend that you go ahead and start putting together a document that is all of the objectives you can think of. So maybe your objective will be something like client will apply to multiple jobs over the next few months in an effort to get out of a toxic work situation, you know, quotes. Maybe it would be something along the lines of, you know, client will learn and practice 2 to 3 new coping skills over the next few months. You know, anything along those lines, but have some of those typical pretty broad objectives on a cheat sheet. You just copy and paste it, put it in the treatment plan, and alter it when or how you need to. Another tip would be to just streamline what you can. You know, treatment plans do not need to be this difficult. I know it's another step in the process. I know it's a lot of paperwork, but they really shouldn't be too time consuming or too hard to put together. So, you know, like I said, if you can streamline certain things, maybe in your paperwork packet, you're specifically asking them about goals. You know, if you've got some of those questionnaires that you can include in that packet, you now have something measurable for later on. So you may even want to put in the treatment plan, you know, at intake clients GAD score was 10. So you've got something to reference later on. So streamline which pieces of this process you can, because it's going to make your life so much easier. And set a reminder somewhere. I know with Simple Practice, you can automatically have it set for 90 days. So it'll send you a notification when you need to review a certain chart. But something else I've done in other places is to put together a like Excel sheet with the client's initials or something, and some identifier that you know that's, you know, HIPAA compliant. So make sure it's like locked. If it's like a written document with the 2 different types of locks, you may want it to be like a password protected document on your website or on your desktop. But make sure that there is somewhere you're tracking it. So I would have like client initials, and I would put in the next row the initial intake date, and then in the row after that I would put when their treatment plan needed to be reviewed. And each month I would go in at the start of the month, look at whoever's treatment plan needed to be reviewed that month, and then change it. So I think that is really helpful. You need somewhere to track this, because once you get a lot of clients, especially, it's going to be harder to remember whose stuff is due when. So have some sort of process where you're able to track it. and keep on top of it. But, well, that's it for today's video. It's a pretty short one compared to some of the other ones. But like I said, treatment plans sort of follow suit. They don't need to be super long. They don't typically need to be super detailed. Just make sure that you have this document that is showing like why the person's there, what it is that you're working on, and how you're going to do it with them. So don't overthink it. There's a lot of other stuff in this profession that we all overthink and have to do. So don't let this part be something that takes up too much of your time. Well, hopefully this was something that will, like I said, streamline your process, make it a little bit easier for you, cut out some time, and we'll check in next episode. Thanks.